So, thank you everyone for joining us tonight, 7 p.m. in London. My name is Braham. I am the founder of Medimatch.io. We are a talent marketplace for healthcare professionals and providers, connecting healthcare talent to new opportunities within the UK. We have a fantastic partnership with King Edward, the 7th Hospital in London, and it's a pleasure to be joined tonight by their very own head of nursing, Elaine Danns. Virtual round of applause. Elaine will be giving a talk on a very hot topic in healthcare at the moment, diversity and inclusion in healthcare, and how to build and motivate a diverse workforce. So without further ado, I would like to hand over to Elaine.
Hi everyone, and thank you for joining, and thank you, Philip, for giving me this opportunity to talk this evening. Like Philip said, we're going to take a bit of a journey through diversity and inclusion and wrap that around healthcare and really look at how you as an individual and also how you can bring that into your organization, and to look at how you can motivate and increase diversity and inclusion within your organization. So we're going to start off going through my career journey and what has brought me, how I got to be the head of nursing of King Edward VII. We're going to look at defining diversity and bringing in a little bit about the discussion around what is equality and the difference between equality and equity. I think promoting inclusion is part and parcel of diversity. So we're going to look at that in a little bit more detail, more about your role and your leadership role, and how that can sort of like sprinkle through your organization to, in the end, to motivate a workforce that is very diverse, but also very inclusive. And then I will hopefully at the end of this presentation, you'll have some ideas about your own next steps for yourself and what you want to take forward and what you've learned about yourself as well. So I'm going to begin by talking about a really nice conversation I had with my dad, who, once I qualified as a nurse, he saw this picture of my group of nurses. I trained in Yorkshire, in South of Yorkshire, and I was in a group of all my students and peers, and I was the only person who looked like me. And you know what I mean when I say that. And he was very, very thoughtful about the career I've chosen, very encouraging. I'm very proud, but he was very real in the sense that to be as good as everybody else makes you average. And I knew the next line of his, the sentence was about, you need to be better than everybody else to succeed. And I think that was my dad's way of introducing and letting me know about the journey that I'd chosen was going to be not as smooth and probably a few bumps in the road as well. And this quote has carried me through every appointment and every interview that I've taken in my career, because it makes me appreciate what I'm doing and why I'm doing it, and also makes me, you know, just dial back the dial a little bit to that day when I was speaking to my dad about my career and my career choices. So it was quite important to me. And on the screen, you'll see my parents in the top corner. They're both Jamaican. And in the bottom corner is my beautiful siblings, and that's my family. I'm the youngest of 8. So in the photo, you'll probably see that there's only 6 siblings in there. I'm that little twinkle in my dad's eye on the left there. And I came along 2 years later after that photograph, and I had another sibling who was still in the Caribbean, and my parents were working very hard to bring her over shortly after I was born. So as most of you know, I'm probably aware of, my parents arrived as part of the Windrush generation, the 40s and 50s, where a lot of the Caribbean islands came over to the UK to support and to prop up the gap in the labour market. And in that, a lot of them came over to get jobs in the NHS, because the NHS has just been born at that point, transportation industry and manufacturing industry. My mum went into healthcare and my dad was in the industrial side of mining. We lived in a very small village in Nottingham. And again, me and my family were the only people who looked like me. But I really do appreciate this photograph, because when I look at this photograph and I look at my family, I asked my parents when probably I was in middle school, secondary school, to most of you would understand that, between the teenage years, and it was difficult being different and not as much diversity in the school at all. And asking my parents that simple question, why would you come and to experience this? Why would you put us, your beautiful babies, through this experience? And it was quite simple, the response I got from my parents. It was about opportunities. And I suppose that's probably, as what I see threaded through diversity, is about opportunity. And it's about giving opportunity, allowing opportunity to be voiced and heard. And it's about seeing the unseen in your organization. And that's a really powerful thing for somebody who is probably slightly different and not the majority in the organization. So opportunity is a word that I will probably bring at the end of the presentation as well, and just to see how you will use your opportunities moving forward as well. So that was part and parcel of where I am and who I am. The next, where I am now, being the head of nursing, it's King Edward VII Hospital, like Philip said, is based in the Harley Street district in central London. And just to give you an idea of how old and established this hospital is that this hospital it's older than Disney. It's older than the NHS. It was commissioned, I would say. It was founded by one person who made a ripple effect, in the sense that she began caring for wounded soldiers following the war and got the approval from the king. And from there, it has grown into this establishment and this brand, which is still here today. And the thing what I love about King Edward's is that it's known for its nursing, the nursing care, compassionate nursing care, and it has a very loyal patient group, but also it has a really strong established workforce as well, who have been there for many, many years. It has a very solid leadership team. The director of nursing, the current director of nursing, is probably the seventh director of nursing in that whole history of this hospital. So that tells you that the turnover in nursing is relatively small, and that for me was a real buy-in. It was a hospital which was champion nursing. So in healthcare, nursing is such it's the backbone of healthcare. It's the backbone of everything. It's what everything needs to be centered around is nursing. So to have an organization which is also pioneering and also champion nursing was, it was a win-win situation for me. And to come into an organization which is so well established at this level, it's an honor and both a privilege and an opportunity which I will use wisely moving forward. And I hope that the opportunity it gives me, I can give to others as well within nursing. So I have qualified originally many years ago in South Yorkshire, like I said, but I recently qualified in 2018. I left nursing probably around 2012, 13. And I came back in because nursing was something that was very dear to me and I was also very passionate about. I think the reasons why I left was probably more telling, and probably I should have done this presentation back then, but it was probably because I constantly was getting overlooked and I could never quite make the transition from clinical nurse into nurse leader. And that was becoming frustrating to the point where I was at a complete crossroads, and I chose to go the non-clinical route to see whether that was the area where I was going to excel and exceed. And I really did enjoy it. And in going into operational management led me into governance, which was back working with the clinical teams and the clinical managers and leaders. But it was a role which facilitated change. You was very instrumental in doing quality improvement, looking at actions, really trying to prevent error and looking at opportunities to exceed in patient care, to get the best where it needs to be. And that role, even though it was really exciting and it opened quite a lot of doors in the sense that I saw healthcare from the front door to the back door. I saw how healthcare worked and how healthcare really was delivered. Not just from a clinical point of view, but more from an operational point of view. And it was really exciting. The only thing that the role didn't do for me in governance was being a facilitator of change meant that I could never take credit for any change that was achieved. And being the nurse that I am, change, making a difference is all what I'm about. And so that was the time when I felt that the role wasn't as fulfilling as what it was when I initially started. And I wanted to enter back into nursing. So I retrained, and in that return to practice course, it's all voluntary, it's all in your own time. But it was great to go back at that time in my career, to go back to the shop floor and to work for 9 months as a student nurse, working with some of the nurses that I trained and had supervised and had mentored and managed. It was a great humbling experience, but an experience that also sort of like wrapped around the understanding about teamwork, about support, about caring and being kind to each other within the healthcare. And it's a hard job. It's not an easy job. It's not easy being a student. It's not easy being vulnerable. And I suppose all that has been very instrumental in me looking at diversity and where I am today. I am doing a leadership, a master's in leadership, and my presentation at the moment, the project that I'm working on is about diversity. And it's interesting how all this has led me to this place, but it's also given me the confidence to do the presentation. And I think when you enter into something which you're learning about as well, I think you grow quite quickly and constantly learning. And that's the actual area that I'm in now, in my stage of my life and in my career, that I am still learning and I am still growing. And I'm growing and learning about diversity each and every day, which is amazing. So, just a minute. So I've got this picture and I wanted you all to take a minute to just to look at that picture and just to see what that picture is telling you. And I want you to ask yourself, what is it that you really see in this photo? And now I'm going to ask you to switch it up. We're going to turn diversity on its head now, inside out. We're going to actually break it down. And when I say that, it's really about you understanding that diversity is an understanding and about individual perspectives. Now, it's about how people see and view the world, their opinions, their world opinions, their values, their beliefs, and underpinning that belief comes their racial diversity, their cultural diversity. And if you're seeing this picture, you're probably seeing only the skin tone, and that's forgivable because a lot of us see diversity as only skin deep. Whereas when I say I want to turn diversity on its head, I want you to look past the skin tone and to see the differences and the beauty of diversity. And when I look at this picture, I do see diversity. I see diversity in age, gender, probably sexual orientation, social economic status, educational status, physical ability, neurodiversity. The list goes on. And when I say I want to turn it on its head again, I want you to imagine this photograph representing your organization as the goal for diversity. And you'll see that all your colleagues and peers are standing by you and with you. You're all looking in the distance, but you all are aware of what the goal is. I all have that understanding, but being appreciative of those differences that we all should be celebrating. So diversity is not looking at the minority groups in your organization. It's looking at your organization as a whole and looking at the potential, what is in that organization. So if it's about perspective, if your organization only listens and hears one perspective, it is not going to be as profitable, is not going to be as successful as what it could be. Diversity allows you to see the talent beyond, and it allows you to invite those voices in. It's about inclusion, and that's when we talk about inclusion within your organization, what it feels to be included, to have a voice, to feel valued and respected. Diversity and inclusion, it stands side by side. And when you're looking at diversity within your organization, you should really be looking at the areas of inclusion and how you do bring your teams together, how you bring your teams in to talk about issues, how your teams are involved, how they contribute. Because when you have a say in change, you are more likely to participate, to contribute. And that's when I say that diversity enriches an organization, because when you've got that rich mix of perspective, you can only get the better outcome. If somebody comes with a problem and you only see the problem from one perspective, you are not going to get the best results. Seeing a problem and an issue from different perspectives makes you more creative, more innovative, and it motivates you because it is you having a say in what is happening in your organization. And that's a pretty powerful place to be. And it's not just down to certain individuals. Diversity and inclusion requires you to take accountability. It requires you to do something. It requires you not to stand back and let one person to raise the subject. It's about you inviting the subject. It's about you looking at how diversity works within every aspect of your organization. And diversity, if you are inclusive, should be at every single point and juncture within that organization. And it should be part and parcel of every process that you encounter. Inclusion is about how you motivate your peers, your colleagues. As a manager, what are you doing to provide equal and equitable opportunities for your staff? And to me, the picture is so important, because if you think about an organization, that's exactly how you want your organization to be: inclusive. Obviously, I couldn't talk about diversity and inclusion without bringing in Marvel, which is my favorite of faves. TV and characters. It's the most diverse group of people I could ever imagine to bring to this presentation. And also, it represents healthcare. We are all superheroes and we all have superpowers. Diversity taps into those superpowers and unleashes that and gives you the benefits of that within your team. And that, to me, is diversity. Michael J was just a bit of eye candy for those who are like Michael J, obviously. So we talk about belonging as well. I brought belonging into this because in the film Black Panther, there was a beautiful scene between Michael J when he was talking about not having a sense of place or purpose, and given when he was accepted into that community. That is the feeling of belonging. But the challenge is to all of us, how do we make this cohesive mix of individuals work effectively together for us? Diversity is not going to be smooth. Different perspectives is not going to be easy to manage. There could be some conflict, but conflict, again, is that part of that journey of getting to a better place. It's about having that professional discussion, debate. It's about bringing in that perspective, but also being respectful and valuing everybody's opinion at the table. But the challenge is that when you have a position where you are in a position of power, you have to actually, you've got to have an awareness about what diversity can also have in the organization. It can have a very negative impact. Some of your colleagues and peers could experience discrimination. And if you are diverse and inclusive, those conversations you're already having, and you are already putting actions in place to prevent that and to highlight that. And again, I will say it's the beauty of diversity. That's what it allows to happen. I brought this picture in about equality and equity because it's every time we talk about equality and equity, you see these images, and the images are really quite telling in the sense that it tells you the reality, what it is like for some people. And some people have more opportunity than others. if you deny or reject that there are issues within certain minority groups within your organization, you are not as inclusive as what you should be. Equality is about giving everybody equal opportunities. But if you've got true diversity and you understand the beauty and the differences of each individual's needs, you'll understand that it's not equality that people actually need. Sometimes we need equity. We need opportunities to be able to excel, to bring our voice forward, to make those actions a reality. And obviously, the last picture would be a dream, wouldn't it, for everybody? I brought this picture in because we've been talking a lot about the barriers, and there's a phenomena that some of you may know of called the glass ceiling effect. And the glass ceiling effect was, in my journey, was when I had done my business degree. I was working on being that manager, that leader, but not getting the opportunity, and was getting constant rejection. And the feedback was, maybe you need more experience in management. Well, actually, if you give me the job, I will get that experience. And that's a frustration sometimes, is that you can equip yourself with the qualifications, but yet you still don't reach those higher grades, those higher levels, jobs, roles in your career. Diversity is appreciating that there are some glass ceilings that we need to break down. And sometimes the unattainable needs to be obtained by some of your minority groups. And how to do that is how inclusion really does work for you and is a benefit to you and your organization. The glass ceiling effect, to me, can be absolutely soul destroying, in the sense that it is part and parcel of the reasons why so many people leave the profession. And as I'm talking from a nursing perspective, we are not in a situation, not in a position to be losing nurses. We really do want to encourage nurses to stay, and we've got to make sure that their careers are mapped to their roles, and that they have a real clear developmental pathway when they join your organization, so they know what steps are needed to be able to succeed and to progress within that career. I think the glass ceiling for me broke down when I arrived in King Edward's. It was an opportunity that, I will say again, it was the right place, being in the right team at the right place, but also being with the right people. Talking about diversity can be challenging. It's very difficult to talk across cultural differences. And the difficulty is that sometimes we are frightened to admit our vulnerabilities and to be a little bit humble. And sometimes we are frightened to offend. Now, we'll talk a little bit about this further on in the presentation, but talking across racial and cultural differences should be a conversation that is also encouraged, but also there is a safe place for people to be able to do that. I spent a lot of my career showing part of my personality, and it didn't serve me well. So I challenge all of you on the call to allow your peers and yourself to bring your whole self to work. And bringing your whole self to work is talking about your diversity with others and talking about theirs. It's about starting that conversation and getting to know somebody on a much deeper level and allowing people to be totally authentic. And the possibilities that that can create for you and your organization is boundless. And it's just, you just need to start somewhere. So the next question, we really do need to understand a little bit about why diversity is important to you. I've explained why it's important to me. You probably need to understand why it's important for your organization. It's a very topical subject at the moment, largely because feeling included and feeling a sense of belonging motivates all of us. It energizes the team. It makes us work better as a team, and our performance as a team is so much more better for our patients, and the outcomes for our patients will be completely different. But it's about support as well. Understanding where you are as a person will also, you need to understand where your organization is currently and being honest about where those barriers are and what needs to be said and done. The photograph which I showed you earlier about diversity and what I consider to be a very diverse photograph, we all have stereotypes, unconscious bias, and it's important to recognize that and to learn and grow into that as well. When we talk about diversity and talking across cultural boundaries, we talk about allyship, and allyship is a sense of empathy and understanding and learning to identify with a marginalized group. If you are the person who is going to be the ally, you have to be very authentic and very honest with what your challenges are and where you feel, the issues, what are in the organization, and try and find out from their perspective what the issues are as well. Understanding diversity is about understanding what the vision and goal for you and your organization is, but understanding that diversity means, and inclusion means, that we all take accountability for the behaviors and the practices and the processes and the systems and the conversations and the meetings. We all have to take part to make sure that we are champion in diversity in every sense. I brought in Verna Mayers into this because I think this quote really does make you feel and understand what inclusion is about. And if you're not part of a marginalized group, you will get this instantly. And this will be part of your journey of allyship as well. Diversity is about being invited to the party. Inclusion is about being asked to dance. Now, we all can go back to our younger self and know how important it is to feel valued, respected, to be part of a bigger group, a bigger movement, a bigger place. Inclusion allows that, and diversity definitely is the vehicle which is hopefully going to take you there as well. So I've left some references at the end of this presentation. I would like you to go and to watch some of her work because she's absolutely amazing. So this part is about us really centering in now about getting the balance right for us, and also what you're going to take back to your organizations tomorrow, next week, but tomorrow preferably. So looking at your leadership, looking at the culture, Diversity can add so much value to a culture. It's not just about a culture of race, but it's about a learning culture, a sharing culture, patient safety culture. It can add so much more to that, because it's about the more you are an inclusive organization person, the more your people will open up to you. We'll look at a psychological safety, and you do need to actually have psychological safety in your organization. You do need to be able to trust that when you have these conversations or these discussions, that they're going to be received with the intention that what you want, that you meant it to be. So for me, psychological safety was when I go back to my first day at work and at King Edward VII, and having a very open and honest conversation with my manager was the first time in my career that I've ever had a conversation where I could talk about who I was, the whole of who I was, not just part of who I was, the whole of me, being so authentic and so real and honest. And it was such a great conversation that we both learned a lot about each other. And it just was a real reminder about why I'm in the role that I was and why I chose and they chose me. And I feel for me, the balance is right. It's perfect. It's, I still got work to do. We've all got work to do. We're nowhere near at the end of the game, but starting the journey is, and that's exactly what it is. It's a start. And I think everybody needs to make that start and have some courage to do that, but in a safe place. You've got to feel that the person you're speaking to is open to hear and is really invested in what you're going to say. Monitoring and measurement is when you understand your diversity goals for you as a person, but also for your organization or your team if you're a manager, or your peers if you're, still working in healthcare. And there's a lot of talk about inclusive leadership. I bring it in a lot into diversity, because inclusive leadership, it sets the tone for what diversity needs to grow from and inclusion needs to grow from. Leadership is so important in this journey that they need to be committed and they need to show you visual commitment as well. I have got in my master's, doing the diversity work that I'm doing, I've got full support from my leadership team, and that is so incredibly important to me. Having that support and that commitment from them means that they are open to my findings and my research at the end of my studies, which is going to be amazing. But when we talk about inclusive leadership, this paper, which I've referenced here, is absolutely amazing. It just is a two-sided page, and I like to read quickly, and I don't like to read reams and reams of books, but it just niches it all together in 6 really succinct points about what inclusive leadership is. But inclusive leadership is needs to have an environment where it can grow, and that's an organization that's ready to receive as well. And they talk about empathy and humility being the most important assets within that leadership team. Humility in the sense of able to admit where they need to learn and grow, but the humility in knowing as well that where they want to take the organization, what that goal is and what that actually looks like and feels like. And the empathy of understanding the difficulties, but also recognizing the barriers that some marginalized groups do experience in the organization and workplace. And I think that's a really powerful place for your leadership team to start with some humility. And then obviously being a leader, you do have to be aware that self-awareness, again, that self-growth is really particularly important, knowing where your blind spots are, and doing the work to overcome them as well, so that your blind spots don't actually impact your work and your team and your decisions, and that you are open to see different perspectives. And that is recognizing, doing that work to recognize those blind spots. It's really important. It's probably really key for your leadership team to actually acknowledge. If you are in communication and you do engage with your leadership team, this paper is really important if you want to read that before you go into those conversations, so that you are equipped and tooled up with the right understanding of where you want to go, but have an understanding yourself personally about your experience of the organization and your role and your impact and really what you want to gain. I think that is the most important, the most powerful driving tool for diversity and inclusion, having your own self-commitment along the journey. I said in the beginning of the presentation that we will talk a little bit about motivating a diverse healthcare and system that you work with. But and I've mentioned it quite a lot throughout, so I won't repeat everything on this slide, but starting with that conversation is the most important thing you can do. Self-awareness is absolutely so powerful in that it will help you to be comfortable in the discomfort. It's not easy talking to somebody, asking somebody about their experience or cultural differences, but understanding a person, you need to start from a common ground. You all work in healthcare, you all have, you all understand each other's roles. So start at that common ground first, and then to see how you can bring diversity into that. If you're a change agent, that we all are on this call, every person who's listening this evening, you are part of this change, and having that conversation is going to create the first ripple in your organization. And that first ripple is what it needs. It needs to happen for it to empower others. But once you started that ripple, if you're a manager or a leader on this call, you have got to recognize that you really do need to give time and space and support for those conversations and that real rich history and experience to come forward. It's no point having a diversity and inclusion committee when all you're inviting is the managers with the same perspective. And it means that you're all going to agree on the same things. Having a diversity and inclusion meeting where it is open forum for your organization to invite, but also to support people to be able to come into that. So whether that is supporting time after work, in work, you've got to create some space for those conversations to have. And it's got to be a forum where everybody has an opportunity to hear. I think it would be the most disappointing, disheartening experience going to a forum and not being able to speak and to have a voice. And you do need a voice. And some people who can't make it to these meetings, you need to be their voice. And that's the whole point of allyship, something that I really do encourage and promote in my role. And I really do want you to see how you can take that role forward for yourself as well. And obviously it's about increasing awareness about the subject as well. Now, obviously coming from a nursing background, I was really interested to see what the Nursing and Midwifery Council had on their website. And this is one of the tools, and they have quite a lot of toolkits actually, which talk about racism, but it talks about anti-racism. Now, anti-racism was something that I was reading up about as well. A great speaker, How to Be an Anti-Racist. I will find his name and then I'll come back to you in the chat. Hopefully I'll have it somewhere. But his book was absolutely amazing, and I do encourage you to read. The next slide leads on to that, because becoming anti-racist is a term that nobody wants to identify with, that term of racist, as it's an insult, it's a derogatory word. But an anti-racist is somebody who, like we spoke about earlier, humility, somebody who understands there are differences, but wants to move towards the growth zone. And how this image here, it really does simplify the 3 areas where you really can ask yourself that question about awareness and learning about yourself, or where your own blind spots are. I'm not saying that everybody and anybody on the call is a racist, but I'm telling you, this tool is so powerful in that it also gets you to challenge yourself and your thinking and your own perspective, so that you are more willing and open to receive other people's perspective. I said that diversity inclusion was kind of like this image is about, it ties everything together quite nicely in the organization for yourself. And to summarize, it is about looking at values and beliefs and the way that people view the world, their perspective. Inclusive is about having a staff voice, but also having really encouraging people to contribute, to add value to their work, to their team, to their organization. It's that mental health well-being. You want everybody in your organization to feel like they belong. And allyship, we mentioned earlier, it's about knowing, wanting to learn and wanting to move your organization through that journey. Again, we talk about accountability, but who is accountable? I held myself accountable, and I feel that the challenge is to hold yourself accountable too. We all know that diversity inclusion makes us better people and creates a better working and learning environment. So ultimately, that's going to deliver better patient care for us all moving forward. So the slide about what next, the what next is for you to answer. It's what you're going to take away. It's what your interests are regarding diversity and inclusion. It's what your organization needs. It's about understanding yourself and your own perspective. It's about looking at your blind spots, your unconscious bias. It's about doing the work to find the knowledge and the skills so that you can actually have some humility and identify with, I'm not going to say that you're actually going to understand the marginalized groups, but you're going to be able to empathize with their needs and understand what changes are needed within your organization. So my last slide is from the big man, Braham. And again, it's a really interesting and really useful thing to say, that change will not come if we wait for some other people, of some person, or some other time. We are the ones we've been waiting for. We are the change that we seek. So I'm asking you all to be change agents moving forward, and to all to participate and to deliver change within your role, within yourself, within your organization moving forward. And that's all I have to say. So I'm going to end it there and hand over back to Philip. So thank you.
Fantastic. Brilliant. That was brilliant. Thank you so much, Elaine. If you want to give a reaction with an emoji, there's a clapping emoji for everyone to give a virtual round of applause. That was brilliant. So thank you so much for that really insightful presentation. We've got about 10 minutes for questions. So if we spend about 1 to 2 minutes answering each question, that'd be great. We've got a few questions in the chat box on the bottom right. So I'm just going to start with the first question, Elaine. What is the hardest situation you've had to deal with as a leader, and how did you manage to overcome it? Get you thinking.
Yeah, it definitely has. I think that as a leader, my hardest and most difficult thing that I've had to deal with is possibly when I'm talking about diversity and inclusion, it's about being in a situation myself where I felt absolutely powerless, but also humiliated. And I think in those moments of in darkness, you have to find the light and strength to move forward. And my light and strength is always going to be my children and my family. And they give me the motivation to keep on going in the face of adversity. I can't apologize for who I am and what I look like, or my culture or my race. And I would never do that. But what I would like, what I think is important is that I have to learn to have those conversations where I need to help people to understand that a little bit more. And I think that can be quite challenging. So I don't take it lightly. Having the conversations is very difficult. And I know that the subject has been avoided for so long and swept under the carpet. And as a person of color and a person who is from Caribbean, I remember just going back to my family, my parents never once complained about their work environment. And I think that's quite incredible, considering that they had nothing to support them. And the strength that I have is that thing that my dad said is always try to be better and to do your best. And that's all you can do. I don't know if that's answered the question, but.
That's brilliant. Thank you so much. I'll move on to the next one. This is from Monica. Thank you so much, Monica, for the question. What are the ways in which employee resource groups, ERGs, such as those focused on BAME, Black, Asian, and minority ethnic individuals, women in organizations, and neurodiversity can contribute to the advancement of careers? What specific activities and initiatives can these groups undertake to benefit the organization?
Wow, that's a big one. That is a big question, because I looked at it from my role and point of view. I work with a diverse group of people. We all work in a diverse team. I think that it really does, the question almost leans into what are the areas and what are the barriers within your organization? What is it that is stopping neurodiversity and BAME staff progressing and doing well within your organization? So it's a very, but there has been a lot of commonality in the research and the evidence, and it is about those stereotypes. It is about you know, those unconscious bias that seep into recruitment, into career conversations, into performance management situations. And it's having that, being an ally. It's about working with managers, working with the staff in your organization to see how they view diversity, and to see whether what your training format is. What is your training trying to target? Is your training specific to your organization, or is your training a generic kind of like an e-learning program, which is just about diversity and looking at just identifying the different characteristics within that? I think you need to break it down a little bit more and really channel into and really do some research into your own organization and work with your leadership teams to actually look at what their perspective is for you and for those employee groups as well.
Thank you so much. The next question is, being the head of nursing, what courses would you recommend, I guess, in relation to diversity, equality, and inclusion?
I've started, so when I'm doing this master's in leadership, and this, for me, this module was part of, it's actually been, it was laced through a few modules. Actually, we did a module on team building, personal development, and then we did a module on human resources. Anything which you can find the almost like the syllabus for, you can bring diversity into that. There is definitely some webinars, there is some great discussions online, some podcasts. I don't necessarily know all the courses were available, but I think that your own learning, you can take it through the modules that you choose to during your masters, which is what I have done. I didn't have a specific module on diversity or inclusion. I've just brought it in as it was one of the issues and passions that I have. And moving forward, I'll be looking at other sort of like study days and webinars and podcasts around it, so to help me on my journey of moving through into that growth and learning stages.
Fantastic. The next question is actually from myself, funnily enough. I was doing a bit of reading before this discussion, and I read that there's about 5,000 band 8Ds and 9s in the NHS. And this was last year, so I don't know if it's gone up, but there's only 2 Filipinos that occupy those positions in like senior leadership positions. My question is, what can the NHS do better to create more diverse leadership teams? I mean, only 10% of the NHS, 10% of the NHS workforce is Filipino, so that is a very, very small number. So the question is, what can the NHS do better to create more diverse leadership teams?
I found some really, I think the work and race equality standard, which is the work which evolved from the Snowy Peaks work, which Roger Klein did back in 2014, which basically looks at 9 key indicators about equality, race equality in the NHS. And when the WRES established in 2015, the data hasn't really shifted significantly in the dials regarding diverse representation, BAME representation at senior levels. What the NHS is doing is, I suppose, they're doing more than what the private sector are doing at the moment, in that they have got real agreement and real targets which are public. And if you go onto their website, you can see that the actions that each trust has actually had to sign into to deliver. So they have a real commitment to diversity. But there are definitely still those barriers which still exist. And those barriers are with workforce, it's with the people like you and I. It's about our perspectives, our dynamics of the people we work with. Our leaders are aware of the issue, but it's we've got to also meet in the middle as well. And I think it's more about what we can do, what work we can do as well. So it's interesting. It's a huge topic. It's we've just, broke off a small snippet. But the majority of BAME staff members are at band 5 or lower. And that is the sticky fall phenomena, which is basically meaning that the majority of employees of Black and minority and ethnic backgrounds are all working the lower grades in the NHS. And the higher grades, it gets lesser and lesser and lesser. I think since the George Floyd, there's been so much change in the US about identifying the issues, but it really does come back to allyship, and it comes back to an attitude and an environment that we need to create for each other to move this forward and to move the dial.
Yeah, we've got a raised hand. Ching, I think you want to say something.
Hi, good evening. It's actually Alan, but for some reason my my name on Zoom is my nickname. Hi, Elaine. Thank you. Thank you for the wonderful presentation. I think my bit on that was around having that conscious and honest appraisal and conversation with staff in your group. And I can say that one of those people that I've worked with in the past that has done that is Elaine. And from personal experience, when you have that honest and open conversation with your staff, may not just be during appraisal, but the conversations that you will have with staff may be catch up, informal chats. If you dig deeper and understand what your staff really want to do in their career and inspire them and motivate them and empower them to tell them that they actually have a seat on the table, and they can move themselves forward. And certainly from my role, and I'm working from Circle Health Group, and I'm part of the Diversity and Inclusion Board. When I go to other hospital sites, it's actually a very moving experience and inspiring feeling.
Are they asking questions now?
Sorry, I've got a voice in the background.
Yeah, someone had to mute someone. Carry on, sorry.
Yeah. And if I'm going to sites, and definitely from our hospitals in the north where it's predominantly white, and I'm not saying that there's something wrong with that, it's actually very surprising to see people from the BAME community talking to me and approaching to me and say, it's really good to see representation like you in the head office, in the corporate in the corporate team, because we haven't seen that for many years that we've been working in the company. We haven't seen a people of color in that team. So in a way, for me, one of the things that really would propel someone and would really inspire someone to put themselves forward is having that open conversation with your line manager or any senior member within your team, and encourage these people that everyone has a seat on the table. And if that organization won't provide you a seat on the table, then that's probably not the organization for you to bring your seat to the table.
Absolutely. Here.
Agree.
Thank you, Alan. That was a very useful contribution there. And I don't know if you guys have worked together, but seem to know each other. Fantastic. We're just running out of time. I know we're over time, but there's a few more questions, and I think it's only fair that we answer them. Hi, Linda. You've asked a great question here. There's a lot of work in regards to diversity and inclusion in the NHS. How can we collectively come together in the independent sector to champion diversity and inclusion for staff and patients?
There was recently, I know the IHP do produce data. They don't produce it at the same quality, at the same level as the WRES, but they do produce data, but it's a voluntary submission. So you don't get true representation of the private sector. And the reason why I'm doing my impact project about the private sector is because diversity and inclusion is not widely spoken about or publicized. And that's probably one of the reasons why I'm interested to know the cultural mix of senior roles within the private sector, particularly as I'm a head of nursing now. I want to know how the private sector does go about looking at diversity and inclusion. And I know organizations do lots of work in diversity and inclusion, but there is, I put an article on the on my reference list called No More Tick Boxes. And I think everybody knows what a tick box exercise is. So read some of the information from there, because it really does give you a different perspective and it helps you to identify when your organizer is being real and authentic, or whether it is just being a tick box exercise, in that it's trying to look at match numbers rather than look at an environment and a culture shift. And a culture shift takes work, it takes time, and cultural change needs to work on many different levels for it to have real influence and change. But that's what this work actually needs. It needs that cultural change for it to actually see the benefits.
Fantastic.
I was just thinking, just going through my notes to see if I've got some references for you, but I can put some references later. I can share some references if anybody wants us to reach out on the subject matter, so I can fill.
Fantastic. Do you want to provide your email address for people to reach out afterwards?
Yeah.
Fantastic. So yeah, if you put it in the chat on the bottom, then people can reach out. This is this is the last question from Abby. What practical advice can you offer to leaders and managers to inspire and encourage their staff members from underrepresented groups who may lack confidence to pursue leadership positions within the organization?
I do that self-work, Abby. I think that work on self is going to give you the courage and the confidence. I'm never going to be able to speak with the passion of other people's words. I'm never going to replicate that. But what I can do as a leader myself is to understand, to empathize. And when you empathize and you are being honest and truthful, you can relay that in a really, you have a great platform as a leader yourself to really be the vehicle of change in that situation. So self-work is always great, but also listen with empathy, and also make sure you create that space, because being approachable is the key to all this. Approachable and having a trusting environment where people feel that they can open up to you is a gift that nobody can take away from you. So if you have that gift, use it wisely and use it well.
Fantastic. So that is it. That concludes our webinar. So a big round of applause, reactions, clapping. There you go. To Elaine. I'll do the clapping. If you unmute yourselves, you could also clap. You're getting a lot of thank yous in the chat. So everyone is saying well done. Thank you, Elaine. Lots of clapping. Thanks. But thank you all as well for joining. I think as much as myself and Elaine have given up our Wednesday evenings to host this, we want to thank you guys for participating and asking such wonderful questions, and hopefully you've taken a lot away from this evening and take back into your work life. So thank you so much. Some amazing comments in the chat, Elaine, if you want to read them before I close it down, but we'll stop recording now. If people didn't see this and you want to share it afterwards, please subscribe to our YouTube channel, and you can share it with your colleagues who may have missed this evening.